Welcome to the Neuro Health broadcast. I'm your host, Dr. Joe, and I am excited to welcome our guest today, Dr. Jill Wagner, who is also the newest member of the team here at Delta Neuro Health. Dr. Jill's focus and expertise lies in the world of gut health and hormonal health. Through her practice as a functional medicine practitioner. So I'm really excited for her to tell her story today and talk about all the exciting things and patients that she's helping. So after a quick announcement, Dr. Jill Wagner. This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the Neuro Health broadcast. I'm your host, Dr. Joe, and today we have a very special guest, and that it is Dr. Jill Wagner, the newest member of the team here at Delta Neuro Health. Thank you for joining us, Dr. Jill.
Thank you so much for having me.
Of course. I'm really excited for our audience to get to meet you and learn about what it is you do and how you are helping so many patients. So before we get into our topic of discussion, I'm curious to know a little bit more about yourself and how you ended up in the world of functional medicine in the first place.
Sure, yeah. Good question. I am a PharmD, so a pharmacist by training. And after I finished pharmacy school, I worked at a major medical center for quite some time. So I became quite familiar with the Western model of healthcare, working in acute care and chronic care conditions, both in the same hospital system. And one of the things that I noticed is that time and time again, patients would come in with a lot of the same symptoms, a lot of the same conditions. They weren't necessarily getting better. They would be given a diagnosis, they'd be told how to manage it. A lot of times that would involve a medication, but it never really got to the reason why those conditions, those disease states occurred in the first place. And when I came across functional medicine and started learning about its principles, it just really resonated with me, because all of a sudden we could go back and see what made somebody have potentially have high blood pressure. What was the underlying factors behind somebody with a headache? Not just giving somebody ways to deal with the actual condition, but finding what caused it in the first place and reversing it.
Mm-hmm. And so what would you say was one of the biggest what's the biggest differences in approach that you've seen with the traditional Western versus more of a functional model?
Yeah, and a lot of chronic disease management with Western medicine, not necessarily the acute side where you're looking at like stroke or heart attack, et cetera, but for the chronic disease state management, a lot of times in Western medicine, you will wait until you have a diagnosis. You'll get the diagnosis, you'll be told about it and ways to manage it. There might be some lifestyle mention, but a lot of times it's a medication. Other ways to go about not necessarily reversing it or making it better per se in terms of what caused it in the first place. And that's pretty close to the opposite extreme of what functional medicine really tries to do, is look at why that disease state, this illness, what is going on in the body, why it occurred in the first place, and trying to unlock it from there and going back. So perhaps you don't need the medication. Perhaps, you hopefully you start to feel a lot better and don't have to deal with that anymore, or to a lesser extreme at least.
Mm-hmm. Right. Makes sense. And for those who may be totally unfamiliar with the world of functional medicine in the first place, can you give us kind of a broad overview of what it is, what those words mean?
Sure. So functional medicine, basically, if I had to describe it briefly, first of all, it would looking at why a disease state, why an illness is occurring in the body,
Hmm.
what brought that change about in the first place. So a lot of times when I go with patients, I go over a very large health intake form, and that encompasses a wide variety of things that perhaps one hasn't even thought about that would be contributing to their current disease state, current illness, current health picture.
Hmm.
So it's really looking at a wide variety of things. Functional medicine too really, really appreciates lifestyle factors, such as looking at, are you getting enough sleep? Is it restful sleep? Are you feeling refreshed? How is your stress? In today's modern world, it's very stress, go, 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 do. Got to accomplish a million things, put, sleep and everything on the back burner and just go, go, go. So looking at stress and how to manage stress.
Hmm.
Also looking at diet is a huge part too. Nutrition, what are you putting into your body? Also movement and exercise, not getting too little, but also not overdoing it and going too much into some like to do a really extreme CrossFit, even if they're feeling really fatigued, really down, really like, oh, I feel awful the next day. So perhaps, too much exercise can also create stress in the body. And then last but not least, definitely looking at toxins as well, just things that we're able to control in our own lifestyle, in our own home, not necessarily worrying about when for things you can't control out in the real world, but looking
Hmm.
at ways to reduce your toxicity in your own environment. And kind of those lifestyle factors really can go a long way in reversing some of the disease states and explaining perhaps why they happen in the first place.
Yeah. And this sounds like it's when it's such a holistic model. I mean, you listed so many different things that you're considering when you sit down with a patient, whereas I don't typically feel that in a traditional Western model always, which is, I think, what drew me to functional medicine as well.
Yeah, and really taking that time with the patient. Our first consult is at least 60 to 75 minutes. So really having that time with the patient to listen to their story and what they've been going through.
Yeah. Which I think brings me to my next question. It seems like functional medicine can kind of be applied to just the majority of people in especially America. But who would you say that you work especially well with, or what conditions commonly make their way into your office?
Sure. One of the big ones is gut health. A lot of patients come in complaining of some sort of digestive complaint. And that makes sense too, because the gut really in functional medicine is known to control so many other parts of the body and can influence other symptoms. In fact, somebody could have something going on in their gut, but it may manifest as something else like brain fog or depression, anxiety, achy joints, hormonal imbalances. So a lot of things happen and start in the gut. So that's why a lot of functional practitioners really focus and concentrating on looking at the gut and going that route. So I really like working with those experiencing some sort of digestive distress, helping them to overcome that and look at reasons why it may be going on in the first place.
Hmm.
And also hormonal balances is really rampant in today's world as well. So many things can throw off our hormones. So I think functional medicine can really help those with experiencing some of the, either for women, the life changes from premenopause to perimenopause to postmenopause, looking at all those transitions and really helping a female woman if women come and go through those changes without it, with fewer side effects or fewer symptoms, I should say.
Mhm.
And then really, I mean, functional medicine can help anyone who has a nagging underlying health condition, something that's bothering them that they just haven't gotten to the root cause of, that perhaps they've gone to the regular physician and they can't seem to pin it, understand exactly what's causing it as well. There's a much different approach that functional medicine can take in looking and trying to discover what's going on.
Mhm. So starting with kind of gut health, that was the first thing you mentioned and seems to be pretty rampant in our country.
Yeah.
Um, Gut issues can manifest in a lot of different ways, and it's not always kind of the obvious, right? So what might a patient be thinking about, when before they seek help with their gut? Like what are some of the things that might present to them that might turn on the light bulb to say, oh, I should probably get this looked at?
Sure. So obviously there are the actual GI complaints, which gives you a pretty good idea that something's going on. I'm bloated, I'm distended, my bowel transit time is off. I have a lot of belching, a lot of GERD, anything related to the GI tract. Obviously, that's probably most likely something related to the GI tract.
Hmm.
But a lot of times, what's becoming more prevalent today is something called leaky gut. And what happens when you have leaky gut is what is in the GI tract doesn't stay in the GI tract. So the food, everything, all the everything that is supposed to stay in your GI tract leaks through these tiny little micropores, basically little openings that go into systemic circulation into the bloodstream around the body. And the body's not supposed to be seeing what was supposed to stay in the GI tract. So what happens when you have leaky gut is you can see a lot of different systemic conditions and disease states. A lot of times it can actually go up to the brain, and now they're thinking leaky gut, sometimes leaky brain, and crossing the blood-brain barrier. So it can definitely influence mood, anxiety, depression. It can affect your joints. Eventually, too, if your immune system is 2/3 of your immune system's in the gut. So a lot of times immune system can be at play too. And eventually, if you have leaky gut and your immune system becomes hypervigilant, it could lead to things such as autoimmune conditions. But it can really manifest in a whole different extra GI symptoms outside the GI tract is what I'm trying to say. But yeah, it can lead to a wide variety of different ailments that you wouldn't necessarily trace back to the GI
Right.
symptoms.
Right. Like you said, I mean, people with anxiety or depression, a lot of times you have to look toward the gut. I mean, what is it? 90% of serotonin is produced
Mm-hmm.
in the
Yeah, and
gut.
50% of dopamine. Yep.
That's right. So it only makes sense that not only do we have to address things neurologically, but also what's going on in the GI tract. So, and why would you say, not to get too off track, but why do you think it's such an issue now rather than 50 years ago or 100 years ago?
Yeah, it's a great question. So obviously, the last, even I'd say 100 years, especially if you think about the way humans that lived 100 years ago versus the way they live now. I mean, first of all, stress actually has a huge dynamic on the GI system.
Hmm.
So once again, it's go, go, go. Stress impairs digestion. I mean, we're up all night, we're on our phones, we're on our screens. That can affect sleep too. So definitely stress affects GI function. A lot of the ways we're eating, we used to have to grow a lot of our own food. And now, to feed a large amount of people in cities, et cetera, a lot of our food we get it from the grocery store. A lot of it is in packages. It's not in containers. It's not per se whole foods. And there has to be, some variability. Nobody's going to eat 100%. Well, some people may, but it's rare to eat 100% unprocessed food. But there's a wide variety of food. So a lot of what we're eating these days too can really make an impact on the GI system and harm it just by all the chemicals. When you look at the back of a food package, I always tell my patients not to necessarily just look at the nutrition label, which lists the calories and fat and protein and carbs, but to really look at the ingredient list, because that is just as important. And looking at the back of that package and seeing what you can find. And once you start doing that, you'll be amazed at really you'll start to question, what am I putting in my body? So all of the food dyes, the chemicals, the pesticides, the toxins, all of that too really can impact the GI tract and create some of that damage. Some of certain medications we're on, while they may be needed, they could still have an impact on the gut. Things like NSAIDs, obviously, are well known to have an impact on the gut. So basically, a lot of our diet, the toxins, things we're putting into our body, and the stress, I think, has really, really made a big impact on our guts over the past 50 to 100 years.
Yeah. Yeah. And I think that's so true. And you look at, say, like bread and milk, while they may still have the same name, bread and milk, what you're actually eating in that bread and that milk is way different than what your great grandparents were eating when they thought of
Mm-hmm.
bread and milk, right? Like it's named the
Yeah.
same thing, but the product is totally different.
You have to have all the preservatives in it in order
Hmm.
to, make it shelf stable. So that was the problem with grocery stores, making everything shelf stable. And
Hmm.
so really, they say the best bread is to buy in the freezer section because it's going to go bad quickly if you don't freeze it. So
That's right. Yeah, it seems like we've
potentially, there's
sacrificed, right. And it seems like we've sacrificed quality for quantity, which, both are valid arguments to make or valid, things to want to achieve. But with that comes less acute issues, but more now chronic issues, which is, I think, where functional medicine is really poised to help out with. So.
Yeah, definitely. Mhm.
And then the second thing you mentioned as something that you work very closely with or see very often, especially in today's day and age, are hormonal imbalances, hormonal dysfunctions. So what might those manifest themselves as in a patient?
Sure, it really depends too. If we're talking about female, especially what phase they're in, if they're premenopausal, postmenopausal. So a lot of, I shouldn't say a lot, but it's becoming more prevalent. I don't know if there's exact percentage, but um, some of the things that we are seeing more often in premenopausal women are disease states such as PCOS, not necessarily disease state, but things such as estrogen dominance. A lot of times, just problems around their menstrual cycle. So just feeling moody, off, bloated, um, a lot of just typical horrible periods, a heavy bleeding, etc. So that goes around looking at what's going on with their hormones in terms of their cycle. And then you get into the perimenopausal stage too, where a woman's transitioning from premenopause to menopause, kind of those years, roughly 10 years or so, where they're kind of in flux. And that can create a lot of a lot of changes too. And this is when a lot of, by the end, at least when your ovaries are making a lot of the female sex hormones, it really shifts over to your adrenal glands. And that's when women can really start to feel like they just can't handle it, and they just can't handle the stress, since your adrenal glands are also responsible for all your stress hormones. And going that end, all of a sudden, a lot of females will say, I used to be able to do this. I used to be able to handle this. That's fine. And now I just can't take it. I feel like I'm going to go off the ledge. I'm just so feeling so much mood disorder, so many mood disorders or rage or whatever it is, but they feel like they just can't handle it. So really looking at that, seeing if the hormones are balanced. We do something at times, if appropriate, called a Dutch test. It's a dried urine test, and you look at all your hormones in terms of female sex hormones, and then you look at cortisol and your stress. Also has some organic acids, which are things that look at some of your nutrients and detoxification markers and whatnot. But obviously looking at that test can be very helpful too. And then obviously there's menopause too, when a female pretty much, ceases making a lot of her sex hormones. And looking throughout these ways, basically, of what's going on with the hormones, what's going on with their lifestyle, ways we can shift. One of the things too, I want to go back to with the Dutch test and estrogen is looking at estrogen detoxification as well. That test is really nice to look at how a female is clearing estrogen out of the body, making sure it's going down the right pathways. So there are things such as lifestyle factors that can be used, targeted supplements that can be used, but they can really provide they're really useful to look into insight that we may not have otherwise had about how that estrogen is being cleared from the body.
Yeah. So if I'm listening to this and I'm curious about, going through with care with you, because some of these things are really, lighting off, uh, light bulbs in my head, and oh, I have that, I have that. What does the process look like when someone's
Yeah,
working with you?
yeah. So I will send out a detailed health history form that a patient would fill out in advance before coming to see me. I would look at that health history form, and on our first meeting, we would sit down for about 60, 75 minutes or so and go over that health history form. And I will probably ask clarifying questions, some other things that come into my mind after I've looked over the form, and really just, obviously get to meet the patient for the first time, get some of their thoughts, get to know them. So that first appointment is really about going over what may have led to the current symptoms and current disease states that the patient would like to try to reverse.
Mhm.
From there, I will go and make a plan in terms of testing with the patient if we want to pursue any type of functional testing, if it's appropriate at that time, based on the form that I saw that we went over together and based on their thoughts and opinions and budget too. And if that's appropriate, then I will recommend certain testing, perhaps certain lab work, etc. And so the patient will go and perform the testing. I might give them a few things to start on in the meantime, and maybe lifestyle factors. It might be a few targeted supplements to help with some of their, some rapid relief of some of their symptoms. And then at that second appointment, we come back together. I will discuss all the results from any testing that they've had. I will also have had a chance to go back and look at everything that we gathered during the first appointment, and I will have put together a plan, and we will go over kind of what my assessment is on what is causing their health conditions or health problems. the general overall plan, and then we'll start to implement it. And I always ask the patient, how far do they want to go each appointment? Is this too much? Is it overwhelming? Do you want to back off? So it just kind of goes at the pace that the patient feels comfortable with as well. But that second appointment is kind of piecing everything together, saying this is where I think we need to go and what's happening and why this occurred. And then from there, each appointment we'll start to, work on what we've discussed the previous appointment, see how it's gone, see what we can add on if we need to change course, etc.
It sounds very targeted, right? There's no darts thrown in the dark. It sounds like you need to identify the problem. You do your best to do that with the extensive testing if that's necessary, and then you go after it, right? So that's amazing.
Yep.
Yeah, which makes it
cool.
very individualized and patient specific, I think, at the end of the day.
Yeah, definitely. It's functional medicine. Yeah, definitely. Every patient is different. Everybody has different genetics, lifestyle factors, history, everything that makes them unique. So no patient is the same.
Right. Would you be willing to share with the audience maybe just like a success story of maybe the start to finish of their care, just to really cement that idea of what care is like?
Yeah, sure. I had a patient who was probably late perimenopause, early menopause, probably around 50, late 40s. So she came in primarily to see me because she had some gut issues. She primarily was having trouble. She was going to the bathroom a lot. She worked in a job where she saw clients during lunch and she would always be interrupted and she would have to go use the restroom a lot in terms of bowel distress. So that was one thing that she wanted to try to clear up her gut problems. And then she also had low energy, fatigue, some mood issues. And she also had a few, per se, last pounds she would like to lose, just 5 to 10 pounds or so. So those were her main complaints or main issues. She was coming to see me and she just felt like her hormones were unbalanced. So one of the things I like to point out about this case is that actually lifestyle changes went really, really far in her, which is great. And it shows that they may sound so simple, but they really can go far. So one of the first things we did was, in terms of lifestyle factors, was just looking at her sleep. She was extremely, once again, a person who was active from the time she got out of bed to the time she went to bed, had a million things going on, and she got very little sleep. And so she said that as soon as her head hit the pillow, she was asleep. Like there wasn't no 10 seconds. It was like, yeah. So that's a clear sign that you have some sleep deprivation going on. So we slowly tried to work with her and with her communication with her family about her need for sleep and needing to go to bed earlier. So that was one of the first things we did, is her starting to just get 8 hours of sleep each night. And that helped her tremendously. That was one of the biggest things. She actually said she had energy before she would go to work, but be unproductive because she couldn't focus. So just getting that 2 extra sleep, actually 2 hours or 2 hours plus, I should say, really made up for like the lack of productivity in the day. And she had so much more energy. She also had quite a bit of stress going on. So we worked on stress. She had a lot of previous trauma. And something with trauma is that it can really impact the body as well. She was getting treatment for that. So that was good. But she was definitely had that that impacted her health. And another thing that we worked on was diet too, dietary factors. She ate little to no protein for breakfast. It was a pretty packaged processed diet, not a ton of whole foods. A lot of that was just due to time, etc. But we really started trying to work on the diet, incorporating more whole foods where she could as possible, and getting more like protein in her diet. And one of the things that looking at her hormones and some of her gut complaints, and I believe she may have had some sinus issues, but one of the big things we tried was a dairy elimination. And that actually fixed a lot of her gut symptoms just by itself. She didn't realize that she had a dairy or sensitivity, maybe lactose, etc. But all of a sudden she could go out to lunch with her clients and she didn't have to go to the bathroom. She actually ended up too losing a few pounds just because she wasn't constantly craving dairy and reaching for chocolate and higher fat dairy products too. So some of the pounds started to come off as well. So that was really encouraging, just looking at some of how these simple, well, sometimes they'd be hard to implement, but it's a simple concept of just trying to take something out of your diet. But yeah, it can also take a little while to get used to it too. So doing that was just a huge success too. And then one of the things we did with her too, because she wasn't eating a whole foods diet and she's interested in some of her micronutrients, is that we did a micronutrient test. And it can show you a lot about what's going on with your body's absorption and digestion of food. Not only are you intaking the nutrients in the first place, but are you actually digesting them and absorbing them and getting across the cell membrane? So the functional test, which is different than even a lot of conventional doctors can run basic blood work, but that just shows you the levels in your blood. And this goes and shows and looks at cellular uptake and how much your body is actually getting and using. So we looked at that, and we found that she was deficient in quite a few key nutrients. She had been on oral birth control for many years throughout her life. So showed that she needs some B vitamins. So we started a B complex, very low and slow, and worked that up. She was deficient in zinc. So we started zinc as well. It showed that her omega-6 to omega-3 ratio, which is your omega-6 to omega-3s, normally should be more balanced. Her omega-6, which a lot of times you'll find in restaurant type food and processed food, etc. It was way off the charts high. So we worked on kind of reducing some of the inflammatory omega-6s that could cause that imbalance, or you see the inflammation when you have imbalance that severe. So we worked on some of her healthy fats, and it also shows amino acids. And once again, we had tried to increase the protein too. This was before, but it showed that her amino acid status was really low. And you need amino acids for things such as detoxification, just to build proper neurotransmitters. There are so many things that, obviously as we get age, especially for females, and you start to have the muscle loss, just really getting in ample protein is really important. So just looking at all those factors and putting everything together with lifestyle, some targeted interventions, etc. And she reversed she was a happy patient by the end. She felt a lot better.
That's awesome. Yeah, and so many moving pieces, it sounds like, that you had to juggle and figure out with her. But then it sounds like the answer was pretty elegant, a lot of simple changes to her life, a lot of targeted pinpoint changes. So that's awesome.
Yeah.
That's awesome. What a perfect example of everything we've been talking about so far too. It's great. I did have another question for you. As far as, typically when people think of hormonal health, they think of going to their OB. When people think of gut health, they might think of going to the GI. And we definitely talked about it in the beginning, kind of the differences between functional versus Western medicine. But why might somebody seek, or why have people sought out a second opinion for those things with you, where they're not feeling that their needs are being met in kind of those other facilities?
Yeah. Functional medicine, as we've discussed, can just look at things in a whole different way. So when somebody goes to see their gynecologist, like their yearly checkup, obviously female, they are looking at things at a specific test, like I had mentioned, the Dutch test can look at. So one thing in terms of estrogen, like you can always draw estrogen levels, you can do blood work, but you don't see, unless you do a test such as the Dutch test, how you're actually metabolizing that estrogen. So it's really cool. It can look at how your liver is clearing it and different pathways and ways you can excrete it more. All of those factors. It's a different viewpoint of how a lot of medical doctors here in the US are trained. They don't necessarily do these functional tests. So it looks at things in a whole different light. And same with GI. There are some specialized testing that we might do if it's correct for the patient, but it just looks at a whole host of different things that a lot of times conventional physicians just they may not be aware of, or they've just been trained in a different way. So we look at things like I've talked about, like digestion and absorption. Are you, using the right, or secreting enough digestive hormones, and digesting your protein, and how is your digestive lining? Is it intact? Are you able to secrete? There's some brush border enzymes, which is just a fancy term for other substances that help digest your food. So we look at things that isn't necessarily shown in regular blood work or regular lab work, and we look at it through a different set of eyes.
Yeah, and I think personal example, we did the Dutch complete cycle mapping with my wife, and we brought it into her conventional OB. It just shows the breakdown of like you said, estrogen, progesterone throughout her cycle, among other things, um, and the different types of estrogen. We brought it to him and we were showing him, and he's like, I have no idea what I'm looking at. I'm like, uh-oh. Like
Yeah.
this is kind of
Yeah. Familiar with this. Yeah.
your arena here. But so that was a little bit shocking and eye-opening. But
Hmm.
it's so great that there are practitioners like yourself who are looking at these things in more detail and more depth to give those more complex patients the time of day and the care and attention that they need.
Yeah. I definitely agree. It's a very
Yeah.
unique, very nice thing to have as a different way to try to go about healing.
Mhm. And so we're just running up on time, Dr. Jill, but I just wanted to ask if you had any parting piece of advice or wisdom that you might want to share with our audience, especially those who might be resonating with the things that you're saying.
Yeah. Just find somebody, keep looking. There's definitely hope for whatever you're going through. Just keep looking for somebody who will listen to you and take your concerns, that they would take your concerns legitimately, really hear your concerns and understand what you're saying, taking the time with you. There are individuals out there who would love to help your body naturally heal itself. And once again, too, the body will find a way to naturally heal itself if you give it the right things that it needs.
Hmm.
So just don't lose faith. There are healthcare professionals out there that are willing to help you in a different way.
Very true. And if patients wanted to learn more about you and contact you, how might they do that?
Sure. They can either email me at the practice here at Delta Neuro Health, and my email address is Dr. Wagner, Wagner, at deltaneurohealth.com, or they could also find me on Delta Neuro Health's webpage as well.
Awesome. Yeah, and if you're listening to this, you probably know how to find us there. But awesome. This was really fantastic, Dr. Jill, and we were so excited to have you on and caring for our patients and providing this service to the Columbus area. So we really appreciate it. Okay.
Yeah, it's great to be here. I'm very excited to work with patients.
Okay. Well, from your host at the Neurohealth broadcast, take care.